Mark, thanks. If you have an individual health insurance plan, there is a chance you will soon be paying a lot more for it. Blue Cross just announced that they're raising rates by 20% in May, and likely other companies will follow suit. Why is this happening, and what can you do? Insurance expert Craig Gussin is here with what you need to know. Craig, thanks so much for coming in this morning. Okay, so we're seeing, well, one company, Blue Cross, says this is what we're doing. It starts in May. Other companies likely to follow right after. Is that right? Definitely. They have to. When you look at that, as of July 1st, every plan in California, individual or group, has to have maternity coverage. Maternity coverage. That's a mandatory issue. All plans have to have behavioral health treatment, such as autism, is going to be covered now. Because of those kind of expenses, the insurance companies have to raise their rates. That and just the overall cost of medicine going up. So if you were not planning on having a baby anytime soon, and you have an individual care plan, and you've been paying one specific rate, expect that number to jump 20%, whether or not you're planning a family anytime soon at all. Correct. And at that point, you're going, you know, what do I do? My costs just went up a lot. Well, the best thing you do is meet with your health insurance broker and say, okay, what are my choices? And we'll go through a bunch of ideas for you. And, you know, depending on what your situation is, what your age is, how much you want to spend, what kind of benefits you're looking for, we can design something. But unfortunately, your plan's going to have maternity coverage, autism coverage. Or fortunately, for folks that may be a little surprised by a recent pregnancy and not have the coverage before. That's exactly true, depending on if you're a man or a woman and what your age is. But that's a big issue. And, you know, I would love the mandatory maternity coverage. Unfortunately, it's going to really raise the rates. And as I've said to Mark in the past and others, you know, if a guy doesn't really need maternity coverage, but the theory is, in the legislation, is that if they spread the risk between everybody, then the cost is a little bit less. Because as we talked about... Otherwise, women would be paying substantially more than men. Right. 6 months ago or 3 months ago when Mark and I talked about this, I went through all the rates for different ages. And the cost to include maternity coverage in your plan ran somewhere between $120 a month to $400 a month, depending on age. More than you're currently paying. Exactly. Wow, okay. Let's also talk about the behavioral health coverage that begins July 1st. What does that include? It includes autism, which is a big key. I just heard you guys talk about it a couple minutes ago. Yes. So autism is one of the biggest issues that I see people are running into. And going, you know, I get phone calls from clients and people I know that are friends of mine saying, how do we get this covered? Well, it's legitimate because maybe that they're seeing that their child is starting to show signs of potentially having autism. They know that they don't have the coverage for it. As of July 1st, you will. You will have coverage, and it goes until July 1st of 2014 because healthcare reform will cover autism once January 1st, 2014 begins. But they took another 6 months just to make sure and get everything set. This is a state law. This isn't a national law. So the maternity coverage and the autism is all California laws. All California. Okay, and that's why you're seeing the 20% rate increases versus in other states. And again, we have, you know, the 8th lowest rates in the country. So our rates, when you start adding all these kind of mandates to it, our rate's going to keep going up. Let's talk about rates for a second. And people that are living paycheck to paycheck. Maybe you own your own business and you have an individual health care plan, and you're saying, I really cannot afford one more dollar, and now I'm about to pay 20% more. What are your options? Options are to talk to your health insurance broker, look at what you have today, what's your main concern, and there's 7 companies in San Diego County that can offer you individual health insurance plans. Actually, probably even more than that. And you can sit down and talk to your broker and say, okay, this is what I'm trying to accomplish. If you're a guy and you go to the doctor once a year, you don't need an HMO plan. Okay. Maybe you go with a plan where you get 3 doctor visits a year, and then after that you have a deductible going towards it. If you're a woman and you're going to the doctor more often, or if you're a man or woman and you expect some health possibilities in the next year or so, you want to make a plan to your needs. And that's one of the things that we try and do as brokers is educate you to what's out there and let you decide what works best for your situation. And that's the beauty of what we want with health insurance, is let you pick it versus the government picking it. There you go. Craig Gussin, thank you so much for coming in this morning. We certainly do appreciate it.